Hello, I'm Rhonda Van Winkle. I'm here at the Smith Plastic Surgery Institute in Las Vegas. It's located on Sahara, and I have to tell you, it's a state-of-the-art facility. It's brand new, and I'm excited to introduce you weekly to Dr. Lane Smith. We don't have anything like this in Pahrump, folks, so really listen in carefully because Dr. Smith is going to fill you in on so many things that you didn't know. He's board certified, quadruple board certified, which only a handful of doctors across the United States are, in plastic surgery, cosmetic surgery, head and neck surgery, and facial reconstruction. So we're going to talk to him today, though, about breast augmentation. Dr. Smith, what is the most common surgery that you perform?
Well, the most common surgery that I perform is breast augmentation, especially this time of year. A lot of women want to get ready for bathing season, so we have a lot of women coming in wanting breast augmentation.
Now, is there a difference between breast augmentation and implants? I mean, can you give us an idea of what it entails?
Yeah, breast augmentation and implants are sort of the same. There are ways to augment breasts without implants, with fat. It doesn't work nearly as well, but basically breast implant surgery, breast augmentation surgery are the same. There are some things that people should know about breast augmentation. One, it is a very nice, very quick surgery with a very high satisfaction rate. It takes about an hour to do or less. Patients recover for an hour, they can go back to work in 3 to 5 days as long as they're not doing heavy lifting. So it's a quick recovery. But some things that patients should know, and they often don't know, is if your breasts are quite droopy after pregnancies and things, breast implants will not lift them up alone. You have to do an implant, usually with some sort of a lift. So that's the most common myth that I encounter. Patients coming in and, with really droopy breasts and saying, I want implants to lift them. Implants are not very powerful at lifting breasts. Breast implants and breast augmentation is best when it's just that for a woman who has very small breasts and wants to make them larger, but not quite droopy. One of the things, and we talked about this a little bit earlier that you asked me, is about the silicone implants. You have a friend, I believe, with leaking implants, and that's a big concern. It is important for people to know that the silicone implants that we use today are much different than the silicone implants we used in the past. The implants we used in the past, if you were to poke them with a knife, were kind of like pudding. The silicone could kind of ooze out, and if the implant ruptured, it could cause problems. The silicone could get into the armpits, get into the breast. Even that was actually uncommon, but it could happen. Also, the old silicone implants had a very high rate of rupture. At 10 years, most of them had ruptured. The new silicone implants, we have some here, are much better. For one thing, they're a softer implant. They have less incidence of kind of rippling or waviness. And the other advantage is you could cut these right in half and hold it upside down, and it really sticks together. It doesn't really go anywhere. It makes the implants much safer. So maybe the second most common surgery we're doing right now is replacing people's old implants or their saline implants with the new silicone implants. I feel that these implants are very safe. I've even put them in relatives who've come to me for breast augmentation. I wouldn't hesitate to put them in my own family. I wouldn't hesitate to put them in a patient of ours. The satisfaction rate with these implants is very high. I do think they are very soft. I think they're very safe. They're very natural looking, very natural feeling, and patients love that. So if you're considering breast augmentation, definitely go get a consultation. Understand again, like we talked before, make sure you choose a surgeon who is board certified or board eligible in plastic surgery and who is well trained and experienced in the area of breast augmentation.
For more information or to schedule a free consultation, call 702-838-2455 or email Dr. Smith at smithsurgery@aol.com.